Despite being the first state to close its borders 3.5 weeks ago, Tasmania is struggling to control COVID-19, taking drastic new measures to try and flatten the curve.
In effect, what this plan will do begins with a temporary closure and deep clean of the Northwest Regional Hospital and the Northwest Private Hospital.
Not only will they be closed, but staff at both hospitals and all members of their households must go into quarantine for 2 weeks.
We expect that this will be more than 1,000 people that will need to be isolated, and as well as their families as well. And so a significant number of people on the Northwest Coast will be moving into quarantine and self-isolation.
Of the state's 133 cases, 61 are in the Northwest, 49 are linked to healthcare workers and 35 are healthcare workers.
I want to say that I'm sorry that we've needed to do this, but at the end of the day we need to get on top of this. We need to ensure that we can crush this virus at its source, and with this outbreak we need to take these steps.
All retailers on the Northwest Coast will also be forced to close their doors, but there will be exceptions for food, alcohol, medical, petrol and other supplies.
We've been working night and day.
All retailers with online and delivery services may remain open. Following a deep clean at the hospitals, the emergency department should reopen within 42 hours with fresh staff.
In order to retain as much hospital capacity as possible, we are expanding and bringing additional staff into the Mersey Hospital to allow it to take the vast majority of patients from the Northwest Regional Hospital through this period. There will be a limited few that may have to go to other hospitals in the state, and that will depend on whether or not the Mersey is able to provide them with the care that they need.
Existing patients will be transferred to the Mersey Community Hospital. Patients will only be transferred out of the Northwest region if there's a clinical requirement to do so, and if that happens, we'll ensure that they are fully protected to ensure that we have the utmost high infection control measures in place.
Authorities are hopeful that after the 2-week period, the restrictions can be reviewed.